And sort of how did you first hear about Physicool?
Well, actually, it was a patient of mine who brought one in. He'd been advised by his physio to use it. And he said, "You must use this after you have your knee replacement." And he was sat by his bed. And as I came around to see him the following day after surgery, he was there starting to put it on. I was just completely amazed. I said, "What are you doing?" And he said, "Oh, I've got to use this. I've been told I must use it." And he was raving about it. And I saw him then at 6 weeks afterwards, as we normally routinely do, and he was saying how fantastic it was and how it reduced his pain and the swelling went down and therefore his movement was better. And obviously we're constantly looking for ways to improve all of our patient care and their pain relief. And if we can reduce their pain, we can get them up moving quicker. Mm-hmm. They mobilise obviously quicker, they not only get out of hospital quicker, but it reduces their risks of blood clots. Yeah. And all other sort of hospital-acquired infections. So that's our aim, alongside other things we do. So I thought, well, let's give it a try. We currently use a standard cryocuff, which I think most hospitals around the world probably use to treat patients after knee replacements specifically. And I just not really.
How do they
convinced.
really work then?
Well, it's a slide-on system that then attaches to an ice bucket whilst they're in hospital.
Okay.
The cold water, icy water circulates, cooling the area, and there's loads of studies to show that cooling helps with obviously pain and swelling, especially after knee replacement. It's a proven technique, therefore most hospitals use it. Okay. And the problem is that we give those to the patients. They cost quite a lot of money, and they're not reused, and they're put in the fridge by the patient when they go home. They can't use the ice buckets, because they cost about £90 each, the bucket, so they stay here. Yeah, yeah. The patients then, when they go home, take them out of the fridge, slide it on, and then put it back in the fridge after their use. So it has quite a lot of limitations that patients aren't able to do any exercises whilst it's on, and when they go home, patients report that after about 5 minutes it's no longer cold. And you can't freeze it because it's too stiff to get on the knee. Okay. Yeah. So there are quite a lot of limitations with it, not only the cost, because they cost quite a lot of money, and the amount of expenditures is, when you look at the figures per year just for a relatively small unit like this, it's quite considerable.
Yes, okay. So how have you found Physicool then?
Well, we've initially obviously quite a lot of people resistant to change and they're not used to things. Yeah. So you know, with gentle encouragement, it's been very successful. We've found it works brilliantly on the younger patients who are much more motivated and able to use it themselves. The trial that we've done, we didn't exclude anyone. We had all come in, so we even had 95-year-old little old ladies using them. And they did struggle a little bit because obviously the application and everything themselves. So, but again, I guess it's the same with the cryocuff. When they go home, they're not going to be able to.
They're going to be the same ones that find that difficult to apply. Yeah.
So the younger patients have found it brilliant. They we've done a proper trial that we compared the use of the Physicool versus the cryocuff. And we had 20 patients in each group, and I said we didn't exclude anyone. And we found that the Physicool on the first post-operative day reduced their pain scores, and they had a better range of movement following the use of the Physicool compared to the cryocuff.
Oh, that's great.
The second day, the change was a little bit less, so certainly that first 48 hours, it made a dramatic difference.
That's where we feel that the moment there's massive inflammation, that's when it really works at its heart and at its best. And did they find it was easy to use and easy to reuse themselves?
Yeah, as I said, the younger ones who were more motivated had no complaints whatsoever. So the older patients, I think that it will be something that it probably might not be suitable for all patients.
You have to manage them a bit more.
But there is certainly the application was fine, and I think once everyone got used to it, and how wet it needed to be, or how much to wring it out, and making sure that everyone was told you have to reseal the packet, all these things, and not let it get too dry, otherwise it doesn't work, etc. So gradually, with time, everyone's got used to it, and so people, as I say, are resistant to change, but gradually, bit by bit, everyone's coming around to it.
You think that this will be much more cost effective, surely, for you?
Yeah. In rough terms, it would probably be about a third of the cost for us compared to what we currently use. And that's not even including the ice buckets that we have to use with the cryocuff, because, as I said, I mentioned they cost about £90 each for us, and we use a lot of them.
Yes.
They go walkabout. So we have to buy a load more each year. So even if we, to the basis, if we only used on 100 patients a year, we would certainly save a significant amount of money.
Well, that's really good to hear. Would you think that this is something that other hospitals should try and use?
Yeah, definitely. I mean, I recommend it. As I said, I think we're working and found out the patients that it really will be useful for. I mean, we've just concentrated on the trial on knee replacements. So, in fact, I got told off by the physios for using on a few trauma patients who had come in with swollen legs or conditions where big hematomas, which is basically just a blood clot, deep blood clot. I had a rugby player who came in with a big thigh hematoma, and treated him. He was fantastic with it on, had no pain, it wore off, and his pain came back, so we just kept treating it, and he thought it was amazing. And I got told off by the physios for using that because we had to stick to the indications. Then I found them 2 days later using it on a patient who had a cruciate ligament reconstruction.
Brilliant.
And they're a group of patients who we don't currently use anything on, and they're all mostly in their 20s or 30s.
Yes.
And they thought it was fantastic.
Yeah.
Really made a big difference in their first sort of 48 hours of pain relief.
Yeah.
So that's again another indication. I think there's lots of indications for its use, and as long as we stick to things that it will work for, I think it will be fantastic.
Yeah, well that's really good.
As long as we don't start pushing the boundaries, yeah, I think it will be great, isn't it?
No, I think
I don't know if you wanted to get some photos of applying it to a patient who had a knee replacement.
Brilliant. There you go.
Yeah, should we do that?
Excellent. What a good idea. Good.
Right. So this is just is it on? Yeah. Okay. So just applying the bandage. So this gentleman's a few days following a knee replacement, it's doing well. So this is how I do it. So just squeeze some of the excess liquid out of the bandage. Okay, put that down. We're just simply just going to wrap this around your knee. Okay. That's going to be on there now for as long as you want it to be. And what it's going to do, it'll make it nice and cold.
Yes, they've got a...
Yeah, and then we will...
They've got something.
Yeah, and then what it'll do is it will help to reduce your pain and swelling and make it a lot easier for you to mobilise.
Do I have paracetamol?
You'll have lots of other substances to help with your pain. But simply how we apply this, because of the because it's just a bandage compared to the standard cuff, patients are able to mobilise, they can do their exercises whilst it's on, and because as the pain and swelling comes down, it means that, as our study showed, that their movement is improved following the use of the bandage. So that can be left on now, and it's easy to take off, as and when the patient wants to do so. Okay, so we can just take that off, and all you simply do to take that off is we just roll that round, and then just wrap it. Take it off like this, and you can do this yourself.
I see. Okay.
As you want to, and then that's still. Depending how long it's been left on for, it's still moist, and as long as it's moist, it's working. And again, our study showed no problems with the wound or wound healing or cause of any problems with the skin, and will cause no dressings. We've made sure that until the wound's completely dry, a dressing, waterproof dressing, has been used to protect the underlying skin. But we've, as I said, had no problems with its use or any complications as a result. Simply the bandage can be popped back into the bag, and there's still some fluid in there, and we just make sure that that's simply sealed up and is now watertight and for repeated use. And obviously we have the bottles that are given to the patients, and whilst the bandage is on, that can be sprayed whilst it's on on the knee to keep it cool. And so in fact the patient can keep that on and don't even need to take the bandage off if needs be. There's no problems with it being left on till it goes dry. As soon as it goes dry, the cooling actually stops, so there's no risk of causing ice burns that can happen with ice packs.